Welcome again, dear viewers, today to a new episode of Visit, and thank you very much for all the wonderful inquiries to me. From people for whom it is important to receive medical advice from a holistic point of view, and I actually want to start right away. The first question was a patient whose husband has Parkinson's, and she asked about a therapy about taking galactose. Galactose is very often forgotten, but galactose is actually the breakdown product of lactase. That is, milk sugar, and breast milk is very rich in galactose. Our small intestine splits milk sugar into galactose and glucose. And this galactose is of great and valuable importance for the human organism. It's winter right now, and I have a wonderful tea here, and also added a spoonful of galactose because galactose is also a sugar against forgetfulness. The galactose is a sugar that acts as a scaffolding substance for the structure of our brain and nerve cells. The galactose is involved in all energy metabolism processes and in the provision of hormones as well as coagulation factors. This is why it is so important that we know that galactose becomes energy. And now there are a lot of us humans who have insulin resistance. By the way, that's another topic to discuss very specifically. And we know now that Parkinson's, but also dementia, and many other diseases can also be traced back to insulin resistance. What does this mean? This means that the cell, of which we have 700 trillion, has insulin receptors. The sugar or insulin must dock onto this. Only then can the sugar enter the cell. You know that glucose is our fastest supplier of energy. And we always need glucose when we need energy. That's why an energy bar or a banana, or I was amazed when watching a marathon in the end, the athletes all got a non-alcoholic beer. This is easy to replenish the sugar, of which you have now really emptied all reserves. But if you suffer from insulin resistance, then it is actually not something that you necessarily feel for years, but that you slowly notice that the sugar metabolism can change. And this insulin resistance is nonetheless of great importance for the development of mitochondrial disease. So when the energy powerhouses of the cell simply switch off slowly because they no longer have enough substance, including sugar, to provide energy. Galactose is the substance one that reaches the cell despite insulin resistance, and also the synaptic activity. Synapses are actually the connection points between nerves. That means that energy, or better said impulse, of the nerves that acetylcholine can be transmitted, and galactose is responsible for this. That is why galactose is a very important therapeutic focus in the context of all neurodegenerative diseases, so where the brain needs support. ALS, Parkinson's, multiple sclerosis, dementia, decreasing concentration, and of course also with the very special insulin resistance, because there is an area in our body that is dependent on this brain sugar. So we can also make sugar from protein, and we can also make sugar from fat, so that we are always supplied with energy. But there is a part of our body that relies on sugar. That is why we also speak of type 3 diabetes in dementia, if there is insulin resistance behind it. and that is to be investigated. And therefore, also with Parkinson's patients, please also always add the galactose. It comes in a glass and you use it like sugar. And depending on whether you do it prophylactically or whether you do it therapeutically, add a spoonful of galactose to a cup of tea 2 or 3 times a day. You avoid a possible insulin resistance. And I can also recommend it to you as a prophylactic to include the galactose. The brain needs about 150 grams of this galactose a day, which is actually provided through the breakdown of lactase in the small intestine and made available to the patient. I hope that with this I could give you a brief explanation about galactose and come to a second question today. This is a young patient who had surgery on the thyroid gland some years ago. And since then she has said she has had, as she writes, a very unsightly scar in the neck area which has not healed so nicely, and it has such a keloid formation. That means keloid formation is some severe scarring. And now she asks me, what can she actually do there? She also has a little bit of padding, which is called edema, in the morning hours under the eye, and asked me this question. The first is, so we can treat scar keloids quite well with DMSO. DMSO is dimethyl sulfoxide. And whoever wants to deal with this substance, which is originally from the tree bark, but then it is processed again in the laboratory, they are very welcome to do so. I recommend Hartmut Fischer's book to you, the DMSO Manual. Hartmut Fischer is a naturopath and engineer and really explained this substance to us with a great deal of simplicity. And I was intrigued years ago when I read this book. DMSO has an anti-inflammatory effect, regulating improving blood circulation. DMSO regulates the lymphatic drainage. DMSO is like a carrier substance. DMSO can bring everything you associate with DMSO down to the cellular level. That means there are many drugs that are only soluble in water. There are drugs that are fat soluble. Then it also depends in our body how far this drug can be metabolized. If we add DMSO to this, then you can actually call DMSO the carrier. And especially with scars, the effect has been unbelievable. DMSO in 30%, maybe with sodium chloride 0.9%. These are ampules of 1 to 2 millilitres. And then take, for example, 2 ampules of 2 millilitres each, that's 4 millilitres, and take 6 millilitres of DMSO 30% on a 10 millilitre syringe. And then you can actually, or not just in the syringe, you can then put it on a cloth and then drizzle it over the scar. Or really leave it on overnight. In my opinion, this is a very, very good keloid treatment. The other, I also think colleagues might be on it. I am a neural therapist and we work with Procaine or Lidocaine in the question of actually restoring the ability of a scar to regulate at that point. And the treatment of scars with Procaine, 1%. The treatment for this with the Cutis compositum, for example, from the Heal company, can improve the ability of scars to regulate. unbelievably in the sense of a meridian treatment. But the company, or not the company, the pharmacy in Saarbrücken, the Victoria Pharmacy, has a DMSO in the form of an ampule, and it also contains, for example, the Procaine and magnesium, so the DMSO MP, and you can infiltrate that directly subcutaneously into a keloid scar. So if a family doctor would then like to integrate this treatment into their concept in the future, this is a very successful and very nice therapy in the treatment of these scar keloids. But then you ask me a second question. And this second question now needs an answer. This is the eyelid edema that you have in the morning again and again, as if it were puffed up, which then subsides throughout the day. In this regard, 2 things from my side. Please measure over the day, maybe 2 or 3 days, your urine pH. The pH is ultimately also a measure of the regulatory power of your kidneys to keep the acid-base balance in our body balanced. Now, of course, our body has a very big strategy to establish an equilibrium within the scope of its pH value shift, while the blood has a very stable pH of 7.1 to 7.4. This can vary in the kidneys, in the large intestine, in the small intestine, in the bladder. A build-up of acid causes eyelid edema in the morning. And that's why it's very important that you take a look. Namely, in the morning, you have to start with a very acidic pH, approximately 5.5 to 6.5. But then the pH needs to become a little more basic in the morning hours, then drifts back down, and actually goes back to a slightly basic area in the afternoon. This is important. This is important for the amount of sodium bicarbonate. This is important for the amount of minerals you have. And if you find that your body is in a certain, let me say, acid rigidity, then it is very important that you give it enough sodium bicarbonate. I have noticed, for example, that many people who take the Pantazole or these acid blockers believe that they can get on a little bit unprotected. They create a great imbalance for themselves, because if through the Pantazole they block the cell, is blocking the stomach cell in the production of hydrochloric acid, then I have to tell you it also produces sodium bicarbonate, and this sodium bicarbonate is the big regulator for the stability of our acid-base balance, in addition to many other basic buffers. The iron buffer, the hemoglobin, there are quite a few, which now help us in the corresponding compartments of our organism. But you should use this bicarbonate, sodium bicarbonate, when you see that the body is in a certain acidic state. Then take it in the morning and in the evening for a while with a glass of water. The other is if you start with a very basic pH in the morning. That is 7, 7.5, and then also works up to 8 and also remains in a basic area during the day. Then I have to tell you, is it just as pathological because you hold the acid internally, and that is indirectly an indication of a lack of potassium. Potassium is our most important intracellular mineral for the sodium-potassium pump. And then it is important to consciously take in potassium for 10 days. There are the Calinor effervescent tablets. Please check your urine again and try through good mineral substitution to regulate this mineral balance better overall. You can control that with a maybe also mineral-containing base powder. These don't all have to be things that last. But it's very important to understand these things. The ocular edema below the eye, or sometimes the upper eyelid, these can of course also be a sign of a correspondingly impaired kidney function. Here too, it is important to just take a look at the kidneys. This is the cystatin C, a very nice parameter that indicates a certain weakness in excretion, but also to stimulate the kidneys in their excretion with birch leaf tea, with nettle tea, with solidago, with the goldenrod. I love Mother tinctures of Ceres. These are things that help us really well. Also, don't forget, the kidney is an organ that is always associated with anxiety, which is always related to a problem. When the flow of emotions leaves us, when the harmony between two people is no longer what it used to be, then the kidney can be blocked in its excretory function. Then these are sometimes temporary disturbances that we observe in ourselves. And a third observation we make is when humans have parasitic exposure. Here too it is worthwhile to do a parasite diagnosis on individual trichomonas, toxoplasma, worms, leeches. This is so valuable to see to what extent the body's ability to regulate is also wonderfully restored after a parasitic treatment. And I hope and wish you will find yourself to be relieved of this problem somehow. I would like to answer another question that a patient wrote to me. And now maybe I can read it here again for a moment. She writes that her mum is taking a fat metabolism supplement. And I had said something about Q10 on one episode, and she didn't really get that. Q10 and the statin share the same metabolic pathway at the level of cellular energy supply. That is the background. And the Q10, so this valuable enzyme, is it needed by the mitochondria? These are the energy power plants. Within these energy power plants, there are so-called respiratory chains, and in the respiratory chain 1, 2 and 3, you need this so-called coenzyme, so that reaction A goes to B. Without this, the 38 millimoles of ATP cannot be produced. You can say Q10, you can also say ubiquinone. These are all things that also have a high antioxidant value. You all know that the metabolism of oxygen produces free radicals, and these free radicals have a highly toxic effect, retrospectively, on cell metabolism. That means we have to focus on a high dose of Q10, of course also glutathione, alpha-lipoic acid, vitamin C and E very well in our diet, or possibly through dietary supplements. And especially in times of stress, especially when we get older, especially when we are also smokers, which I don't hope you are, Q10 is an incredibly valuable coenzyme for this energy metabolism. And I wish and I hope with all my heart that this paradigm shift, which is slowly creeping in so very quietly in medicine, which is of course also demanded by you, we doctors are also demanded to deal with the things, but that it also moves to Germany, Austria and Switzerland, because there are no cardiologists in Norway or Belgium who do not prescribe Q10 to a heart patient, for example, because they know that the human heart cell has far more mitochondrial power plants per cell and how dependent the heart cell is too on an intact mitochondrial metabolism. And whenever these mitochondria are weakened by the environmental toxins, by heavy metals, by glyphosate, by too much iron, also by radiation, by Wi-Fi, by all these processes, then the body gets into an energy shortage. You can measure the Q10. The Q10 is measured in milligrams per litre, and the lab states that around 1.4 would be normal. I have to tell you, in all honesty, this is a value I don't really want to leave standing like that. I always want to adapt it to the appropriate times. When I pick up people in a pregnancy, in preparation for a competition, in a very stressful situation, in an illness. We know that people with neurodegenerative diseases, such as Parkinson's, need high Q10 levels. It has to be around 3.5 to 4. That means every high-quality Q10 preparation, which is a bit more expensive, but please, if you want to get a real therapeutic consequence from this and really strengthen therapy, then the Q10 level, which can be measured using the serum, should be your base and should be checked if anything changes. And if I take a statin on the other side and I know now it takes a slow build-up of a good Q10 level, then you should not put 1.4 to measure, but at least 2.5, and please have it measured now. And then maybe after 6 or 8 weeks, and start with around 200 to 300 milligrams of Q10 of a high-quality preparation. Q10 is very difficult to manufacture. The way to clean it is very difficult. And that's why, in this regard, you should treat yourself to a good Q10 supplement. It's on every package, but because it's over the counter, please take 30 milligrams a day. And that is the advice from me. For such clinical indications, you have to start higher and can really do that without worries, because the mitochondrial functions in our body are incredibly high, and it would take an immensely long time, if at all, if you start so low. So in this sense, thank you very much for this Sunday evening episode, for this time of Visite, and I wish for you for the next week a very healthy week. And I'm already looking forward to next Sunday. Goodbye. Dear viewers, the preceding episode is an indicator for a holistic medical approach and does not replace visiting your family doctor. Thank you.